Surprised that more and more people are considering cosmetic surgery, with technological improvements, easier and quicker recovery, and no visible scar techniques readily available. In fact, according to a recent national survey, the number of cosmetic procedures performed has increased by at least 50% over the last 5 years. During the next half hour, we'll talk to a board-certified plastic surgeon about sculpting the ideal nose, battling the elements and time through facial rejuvenation, and breast enhancement surgery. All this and more on MDTV Medical News Now.
Radiation, whether natural
Well, I've been through several consultations.
Was there a break after that, remote? I'm Pat Murphy-Stark. Welcome to MDTV Medical News Now, a program dedicated to bringing you leaders in the field of healthcare that are in your hometown. Our show strives to give you the latest information about new techniques and treatments in the field of medicine. Next to hair transplants, rhinoplasty, or aesthetic surgery of the nose, is the most popular cosmetic procedure with men, and the leading procedure performed in this country on people 34 years old and younger. In fact, there are 3 distinct profiles of people who seek out rhinoplasties. The first are the teenagers who prefer to begin adult life with confidence in their look. Next are young adults in their mid-30s who have decided to treat themselves to something that they've desired for most of their lives. Finally, we have the over 50 crowd. These people may have had great-looking noses their whole lives, but are living proof that the nose seems to change with time, and they wish to regain what they once had. When rhinoplasty was introduced, the trend was for the signature nose. Providing the ideal nose, however, proved a difficult task to reproduce over and over again. Through the years, plastic surgeons gained tremendous experience in nasal surgery. Rather than placing some form of the ideal cookie-cutter nose on everyone's face, the trend now is to provide the right nose for your face, rather than giving you someone else's. We're joined today by board-certified plastic surgeon Dr. Michael A. Epstein. Dr. Epstein has established his practice with 2 locations in the Chicago area. Welcome to the program, Doctor.
Hi, Pat.
What concerns do most people come to you with when they're considering to have their nose surgically enhanced?
I'd have to say that the most important consideration is that the individual wants a nose that fits their face, and they want something that looks natural. They don't want an overdone nose. They don't want a nose that looks like it just screams rhinoplasty.
Right.
And they certainly don't want a nose that looks like somebody else's, so that, you know, they can go around town and say, you know, there goes another Epstein nose or
Right.
another surgeon's nose. We as plastic surgeons over the last 10 years seem to subscribe to the theory that less is more. We try to achieve a result that looks very simple and matches their face in the best possible way.
Doctor, can you share some examples with us of some of the procedures that you've performed?
Sure. I think you'll see on the screen patient 1 reveals that she has a large dorsal hump, and that's like the top portion of the nose is excessively large. And that's the significant portion of her problem, although she also has a slight deviation of the nose and a widened appearance to the tip. And by resecting or taking out the top portion of the nose, called the dorsal hump, and also trimming the tip cartilages, you can afford a much more pleasing look to this individual. I mean, it totally changes her appearance from a profile view.
Definitely.
One thing that you'd want to note, though, is that it really does not change her appearance dramatically on a front view, and which is a big consideration for patients. They don't want to look completely different. They just want to look. They want a nose that more harmoniously fits their face. And then in patient 2, I felt that her biggest problem was she didn't have enough tip projection. So in that case, we actually added cartilage to the tip and did a small rasping, if you will, or took down the dorsal hump in a gentle fashion. Both of these patients did have some septal deviation and airflow restrictions, and those were addressed at the same time, and that's the internal part of the rhinoplasty.
Has technology made an impact on really what you can achieve with rhinoplasty these days?
That's a good question. I think in the world of rhinoplasty, probably the most significant change that technology has made is in the pre-op considerations, in that now there's video or digital imagers. So you can take a picture of somebody before the surgery and give them an idea of what they might look like prior to the surgery. You have to be very careful, though. It's sort of a double-edged sword because you don't want to imply an exact promised result.
Right. One thing that I would be concerned about if I was going to consider something like this, the first thing I'd think, is this going to affect my breathing in any way? How does that work?
Well, in fact, most people that come in for rhinoplasty, or a good portion of the patients, come in with breathing difficulties. And part of the rhinoplasty procedure is to actually correct them. If the septum is deviated, you want to straighten it. If they have enlarged turbinates, those are the little valves on the inside of the nose which can restrict airflow, you want to open those up a little bit. It is true that with a lot of rhinoplasties, people are coming in with big noses, and you're trying to make them a little bit smaller to match their face. And in those cases, we as plastic surgeons have to be careful that we don't restrict the majority of airflow when performing the procedure.
Mm-hmm. And I'm sure, depending on what someone does for a living, they may not want it to alter if they sing or if they're a public speaker. What do you take into consideration when it comes to that?
Well, once again, I think that you have to understand the physiology behind the air that moves through the nose. Most of the airflow is actually traveling through the bottom portion of the nose. And if you don't have excessive scarring at the base of the nose or in the inside of the nose, then you're really not going to restrict airflow too severely, even though you're making the top part of the nose smaller.
Right. Okay, well, thank you, doctor. When we come back, we'll explore options for recapturing a fresh, bright face. Some you may know, others you may not. We'll tell you how each works. And later, if you're considering breast augmentation, we'll give you the inside story of things to consider to get the best, most natural result. We'll be right back.
To learn more about any of the topics discussed on today's show, you can reach Dr. Michael Epstein and his staff at 847-205-1680.
E-business.
What's an e-business?
This is an e-business.
Publishing.
Insurance.
Fresh flowers.
This is an e-business.
Rare book.
Commercial real estate.
Fish sticks.
We could be the biggest drum store on the web, but we need help. Any ideas? If every person on the net bought just one drum, there'd be no war.
At 6 a.m., they begin to arrive from cities around the world.
Heads of major corporations share their vision,
Their strategy.
If these leaders were visiting a nation, it would be called a Global Economic Summit.
When they arrive at Fidelity,
It's called just another day at the office. Just one of the ways we uncover opportunities to help you make the most of your money.
So I pull into this gas station.
Oh, classic oversqueeze. Watch this. Release the hounds. Perfect pump.
2037.
Even at the gas station, you can do more with the American Express card.
To learn more about any of the topics discussed on today's show, you can reach Dr. Michael Epstein and his staff at 847-205-1680.
Welcome back to MDTV Medical News Now. Many people have something they would like to change about their facial appearance. Perhaps you have crow's feet wrinkles around your eyes or sagging cheeks and neck. Well, there are a number of different approaches to treating these problems. To reverse the effects of aging, the board-certified plastic surgeon may turn to chemical peels or laser resurfacing. Both of these procedures seek to stimulate the skin, causing the collagen and elastin fibers to reproduce healthy, active new tissue. The result is a younger, fresher-looking face. Technology plays an important role in most facial rejuvenating techniques. Medical reporter Sean Doran gives us a closer look at the technology behind one option, the laser, on today's MDTV Medical Moment.
America is aging. In fact, someone in this country turns 50 years old every 7 seconds, and our skin is telling all. In addition to the aging process, external factors such as exposure to the sun, pollutants, and smoking cause our skin to lose its vigor and elasticity. By removing portions of the outermost layer of skin, the epidermis, and the second layer, called the dermis, we allow our skin to naturally replace this tissue with new healthy collagen and elastin, which give the skin its structural base and ability to stretch out and snap back to its natural contour. The result is a younger and healthier looking face. Today, laser technology often replaces dermabrasion and chemical peels. Also, because laser treatment is so precise, it is the most preferred technique for treating acne scars. The standard lasers used in facial resurfacing are the ultra-pulsed CO2 laser and the erbium YAG laser. Both lasers use a pulsating beam of focused light similar to a strobe light. The pulse is so short in duration, the heat dissipates immediately. The CO2 laser and the erbium YAG laser work by being absorbed by the water in the targeted skin cells, causing the water to vaporize, resulting in a laser peel. There are some differences between the two lasers. The CO2 laser is better suited to tighten the skin and for use with elderly patients with loose skin. The ideal candidate for the CO2 laser has fair skin, blue eyes, and blonde or brown hair. The erbium YAG laser, on the other hand, is better absorbed by the water in the cells, which results in less thermal damage and quicker healing. Unlike the CO2 laser, the erbium YAG laser is effective on all skin types regardless of race. Both lasers offer a dramatic improvement in static wrinkles and a significant shrinkage of both pitted and raised facial scars. Although laser technology is advanced enough to safely provide great results, it is advised that you seek out a specialist who uses this technology often and is experienced with aesthetic procedures of the skin. This is Sean Dorn reporting. Any questions or comments, please call toll-free 1-877-MDTV-NOW. That is 1-877-638-8669.
We're speaking with a member of the prestigious American Society of Aesthetic Plastic Surgeons, Dr. Michael Epstein of Chicago. Doctor, how do you determine who is better suited for the facial rejuvenating procedures or will require the full facelift?
Well, I think you have to think about it this way. Everybody ages at different rates, and certain parts of the face, of an individual's face, will age at different rates. Okay, typically, a younger person starts to see heaviness of the brows and the eyelids. And that's typically in the age range between 40 and 50. As you start getting closer to 50, and these are ballpark figures, you'll start to see hanging soft tissues of the lower portion of the face and neck. And then you also have to throw into the mix that the skin is aging. The skin itself is actually aging to create actual lines or creases. And that is actually treated in a much different way than the traditional types of surgeries like facelift, blepharoplasty, and brow lift. That's treated with laser resurfacing or deep chemical peel. I think you can see, there's an example I have here of patient 1. She's in her 50s, and she actually has good elasticity to the skin, very few in the way of actual lines on her face or in the skin. But she has sagginess or heaviness of the brows. She has an accentuated nasolabial fold, and that's the medical term for the marionette lines around the mouth. Mm-hmm. And then she has jowling, and that's the heaviness of the soft tissues on the jawline. And then you can also, it's clear to see from the profile view, on this patient that she actually has no neck, she actually has a neck, but it needs to be uncovered. Right. So in this patient, I felt that a blepharoplasty and laser resurfacing, or some type of resurfacing to the skin, was not necessary, but she would best benefit from a brow lift and a facelift, and that's what was done for her. And I think you can see in the post-operative results, she had a dramatic makeover.
Okay. Well, joining us now is a patient of Dr. Epstein's, Laura Robinson. Welcome to the show, Laura.
Thank you. Thanks for having me.
Tell us what you had done by Dr. Epstein.
I had an upper and lower lid blepharoplasty.
And what exactly does that mean?
Basically, he took and did work to my lower and upper lids, which were very covered by skin prior to the operation.
Why did you decide to have something done? You seem so young. It's such a young age. Why was it for you?
Well, first, I went in for a consultation and saw what Dr. Epstein could do, and the reason I got it done at age 28, which could be considered young, is because my skin was more supple at this age than maybe in my later 30s or early 40s, and it was something that I really needed to have done to maybe enjoy my life in my 30s. So
how do you feel after the surgery?
I feel great. It was something that I thought would enhance my features, but it's really done wonders, I think, for my appearance. I'm extremely happy.
Well, that's great. Dr. Epstein, explain to us exactly what you did for Laura.
I think the best way to show what I did was to first look at the pre-op pictures of Laura, and you can see that skin tone was really not an issue. She had excellent elasticity of the lower lids, but she did have a redundant amount of upper lid skin and fat of both the upper and lower lids. So, looking at Laura, the first thing that was done was through an incision made on the upper lid in the natural crease, I removed the excess or redundant fat and the excess skin. And there it tightened up the skin pocket, okay? In the lower lids, the incision was made on the inside of the eye. Okay, because she had good skin tone, I did not have to tighten up the skin because she's 28 years old, has excellent skin tone, so the fat was removed in that way, and therefore there's no scars on the external surface of her face.
Well, Laura, thanks for joining us and sharing your experience today.
Thanks.
When we come back, we'll explore the latest on the front of one of the most popular cosmetic procedures, breast augmentation. We'll be back shortly.
To learn more about any of the topics discussed on today's show, you can reach Dr. Michael Epstein and his staff at 847-205-1680.
Let me make this simple. With the AT&T One Rate plan, calls from home are one low rate to anybody in America 100% of the time. So of the 24 hours, there is no hour when this rate does not apply. It's the day rate, the night rate, weekdays, weeknight. Let me put it to you this way. The time when this rate is not valid does not exist. Is that clear?
Yes.
You see, when I apply myself?
No games. The AT&T One Rate plan.
Claritin. Escape the limitations of seasonal allergies.
Blue skies smiling at me.
Only one tablet means 24-hour non-drowsy seasonal allergy relief. Claritin, the #1 prescription antihistamine for ages 6 years and over. Claritin has a low occurrence of side effects, including headache, drowsiness, fatigue, and dry mouth. All were similar to sugar pill. To learn more, ask your doctor or pharmacist. Call 1-800-CLARITIN.
Trust. We are not born with an instinct to trust. Trust must be earned. Trust must be proven. We earn it with integrity. We prove it with sound advice. Trust is the ultimate measure of our success. And at Dean Witter, we measure success one investor at a time.
To learn more about any of the topics discussed on today's show, you can reach Dr. Michael Epstein and his staff at 847-205-1680.
Welcome back to MDTV Medical News Now. In the time prior to breast implants, plastic surgeons were often called upon to provide solutions for breast deformities, perhaps resulting from birth abnormalities or from the treatment of cancer. From this experience grew a much better understanding of breast surgery in general. Plastic surgeons developed techniques and materials that served to enhance the appearance of breasts that were perhaps small, sagging, or of different sizes, but otherwise normal. Today, breast augmentation is the third most requested cosmetic procedure following liposuction and facial procedures. Determining the placement of the implant leaves two choices, either on top or below the chest muscle. Each has its own advantages. Placement above muscle gives the breast a more natural appearance, since this is where natural breast tissue is located. Placement below the muscle provides a layer of camouflage, hiding any rippling that may occur on the surface of the implant. Factors that determine the best placement include age, lifestyle, and body type. The ideal candidate for breast augmentation is mature, healthy, and realistic in her expectations. Doctors stress that it is important for candidates to want to improve their look rather than hoping for the perfect figure. Among women who have had breast augmentation, the satisfaction rate is very high. With us now is board-certified plastic surgeon Dr. Michael Epstein. A fundamental of Dr. Epstein's philosophy is to keep his patients informed and educated, and he's here today to do the same for us. Doctor, why has breast augmentation become so popular?
I think it's very clear, Pat, that when you have an operation that works so well, okay, the patient satisfactory rate is extremely high, and it's safe. The risks are very few and far between. The combination of the two makes this a very popular procedure.
What improvements have been made over the last 10 years for augmentation?
I think in terms of improvements over the last 10 years, you have to look to a couple things. The fact that we're doing things through smaller incisions, and that was probably because of the advent of endoscopes and endoscopic work. And then the other types of things that have improved breast surgery and plastic surgery in general is the anesthesia and the fact that the recovery process is so much easier. The drugs that we're using are shorter acting, and the patients can do this in an outpatient basis at minimal cost with minimal downtime.
Now, do you prefer to place the implant above or below the muscle?
In my practice, I do both. And as you alluded to in the opening to this segment, you have to consider a number of different things. You have to consider the patient's anatomy first and foremost. Do they have sagginess to the skin? Is there an excess amount of skin? Do they have enough breast tissue to camouflage the implant? And in those cases that there is enough breast tissue to camouflage an implant, it makes more sense to put the implant in a more natural location on top of the muscle. When you don't have that luxury, it makes better sense to put the implant below the muscle.
What are some of the most important things that you would tell a patient to consider if they were thinking about this surgery?
Well, once again, you have to consider what their goals are. Hopefully the patient comes in with realistic expectations. They want a more natural looking result. They don't want to extend themselves and increase their size by too much, so much so that the skin envelope won't afford them a more natural appearing result.
Now you have some before and after pictures. Let's take a look at those.
Okay. In the first case, you have a patient that has good elasticity to the skin. She has a mild degree of ptosis, and that's the medical term for sagginess to the breast, but yet she has enough breast tissue to camouflage the implant nicely. And she only wanted to go up in cup size by 1. So on top of the muscle, through what's called a periareolar or right underneath the nipple incision was made, and a pocket was made directly on top of the muscle, and the implant was inserted there and gave her a very lovely result. In the next patient, you have an individual that has an excessive amount of sagginess and almost no breast tissue in the superior aspect of her chest wall. So if you were to put the implant on top of the muscle, she would very readily see the implant. You might see rippling to the implant. So it makes more sense to put the implant below the muscle. But in her case, when you put the implant below the muscle, you want to be able to tighten up the skin envelope. Otherwise, the breast would just hang off of the implant and it wouldn't look nice. So she actually has 2 procedures in one where the breast was actually lifted after the implant was inserted.
Thank you, Doctor. Now let's meet a woman who photographs some of the most beautiful areas of the world. She wanted to look her best behind the camera, and that's where our story begins on today's MDTV Patient Profile.
I'm a photographer, and I specialize in photographing the cultures and lifestyles and portraits and lifeways of tribal peoples around the world. Dr. Epstein, unlike many of the other surgeons I met with, didn't seem to be in a hurry, didn't seem like he had something more important to do. At that point in time, I felt like I was his only patient. He showed me how to get the optimum result. I can remember just a little experience of, I didn't want to take off my wedding ring for the surgery, and they said, well, you have to, but as soon as I woke up from the surgery, my ring was back on my finger, so they made sure that they had taken it out of the locker, put it back on. They just wanted to be sure that I was very comfortable. I felt like I was among friends, which was true for the entire process. They were always very concerned for my comfort, for what my questions might be, what I would be experiencing in terms of the recovery.
Okay. And I just want to check out the skin, make sure the incision sites are healing up terrifically. Okay, and here they're doing wonderfully.
I was 40 when I had the surgery, and I felt that, well, my days of bikinis and tight jeans are over, and I felt very much like I look good again in jeans and a bathing suit. And so, and it is definitely a motivator to keep up the healthy lifestyle.
That's a great story of someone really living life as an adventure. Doctor, let me ask you, what is the most rewarding part of your job to you?
Well, I think it's clear from seeing all these patient examples. You're taking patients or people that essentially have some hang-ups with a certain aspect of the way they look, and you're erasing that. You're putting them back into the mainstream, making them feel good about themselves, like Laura that was here today. And then when they come in and they tell me how happy they are, that is truly the most rewarding part of my practice.
We've got to go to a break, but before we do, if you would like information on any of the topics covered in today's show, please give us a call toll-free at 1-877-MDTV-NOW. That's 1-877-638-8669. We'll be back shortly with more medical news now. Stay tuned.
To learn more about any of the topics discussed on today's show, you can reach Dr. Michael Epstein and his staff at 847-205-1680.
There are millions of reasons to fly today. Only one that matters to you. At Delta Airlines, it is our pleasure to get you to the place you want to be. Delta Airlines, on top of the world.
At Save the Children, we have photos and personal stories of thousands of children who need a sponsor, a caring friend, someone just like you. Won't you reach out to one of these wonderful children? Your $20 gift each month is not a handout. It's a hand up. Your contributions will be combined with gifts from others to help provide self-help programs for all the children in the community. Just call and say, yes, I'm ready to be a child's sponsor and friend.
If you would like a copy of today's program, you can contact us toll-free at 1-877-MDTV-NOW or visit us on our website at www.mdtvnow.com.
I'd like to thank Dr. Michael Epstein for being with us today to explain the latest in aesthetic surgery of the nose, facial rejuvenation, and breast enhancement procedures. I'd also like to formally announce that Dr. Epstein has agreed to join our staff as a medical expert for future programs. We're all looking forward to working with him. Well, that wraps up this edition of Medical News Now. For everyone at MDTV, I'm Pat Murphy-Stark. Take care and stay healthy. If you would like more information on any of today's topics, you can reach Dr. Epstein and his staff at 847-205-1680.